Hi, my name is Olivia Lindley. I'm a first-year research fellow in the Harvard-wide Pediatric Health Services Research Fellowship Program based at Massachusetts General Hospital in Boston. The study that I'll be talking with you about today was part of my dissertation research that I completed while earning my PhD in public health at Oregon State University. The study is about the use and non-disclosure of complementary health approaches among U.S. children with developmental disabilities. We thought that it was important to better understand this topic because research has shown that more and more children are using these complementary health approaches, but we don't know much about how many children with developmental disabilities in specific are using these approaches. To start, I thought that it might be helpful for those of you who aren't familiar with complementary health approaches to provide a brief definition. The National Center for Complementary and Integrative Health currently defines these approaches as approaches developed outside of or parallel to mainstream medicine. These include things like natural products such as vitamins, minerals, herbal supplements, as well as mind and body practices like yoga or qigong, chiropractic or osteopathic manipulation, and then other approaches which encompass things like special diets like the gluten-free diet, as well as the use of traditional healers and things like chelation or hyperbaric oxygen therapy. So in studying these approaches, we wanted to know about how many kids with developmental disabilities in the U.S. Use these types of approaches. We also thought that because these approaches are most commonly used in combination with conventional health services, that it was important to also look at non-disclosure of these approaches that occurs between parents of kids with developmental disabilities who are using them and their child's healthcare provider. Because healthcare providers may be working with families around treatment planning for this population of kids. So to look at the use and non-disclosure of complementary health approaches among U.S. kids with developmental disabilities, we analyzed data from the National Health Interview Survey that was conducted in 2012. The reason that we chose this year of the National Health Interview Survey was because it's the most recent year that included a very comprehensive supplement on the use of complementary and alternative medicine, also known as complementary health approaches, among U.S. children. When we analyzed these data, what we found is that almost a quarter of children with developmental disabilities who were ages 4 to 17 years old used these approaches. And when we looked at the most frequently reported approaches used, we found that these included specific vitamins such as vitamin A, vitamin D, as well as specific minerals like zinc, potassium, and also non-vitamin supplements like fish oil or melatonin. We also looked at the reasons why families reported using these approaches for their child with a developmental disability. And the most frequently reported reasons for doing this were that the approaches are natural, for the child's general wellness or disease prevention, and also because these approaches were believed to treat the cause and not just the symptoms of the child's condition. Next, we looked at the non-disclosure of complementary health approaches among children with developmental disabilities who reported using these approaches and also had a personal health care provider like a general pediatrician. What we found is that almost half, 42%, of parents reported that they did not disclose the complementary health approaches used for their child with a developmental disability. When we looked at the most commonly not disclosed types of complementary health approaches, we found these included things like herbal non-vitamin supplements, certain mind and body practices, and also homeopathy. Then we also looked at why parents most commonly reported they did not disclose. And what we found is that they most frequently said it was because the provider did not ask about the use of these approaches for the child. I would encourage you to read the full study if you're interested in learning more about these topics of use and non-disclosure of complementary health approaches for U.S. children with developmental disabilities. And to also think about this question of how can we promote better communication between families and healthcare providers about these approaches used for children.